Something may already be changing in someone you love, and you may not yet recognize what you are seeing. They still remember your birthday. They still tell stories from 30 years ago with perfect detail. They still recognize every face in the family photograph on the wall. They show up to appointments on time. They remember to take their medications, and yet something feels different. Something has shifted quietly in who they are, in how they respond to the world, in how they move through an ordinary day. You cannot name it precisely, but something in you knows that this is not quite the same person you have always known. I have spent more than 30 years working directly with older adults and their families, first in Japan, and for the past 2 decades here in the United States. In that time, I have observed a pattern that causes a particular kind of harm, not because families were not watching, but because they were watching for the wrong thing entirely. They were waiting for the moment their loved one could not remember their name. They were waiting for the dramatic scene, the blank look, the completely forgotten conversation, and because that moment had not arrived, they told themselves that everything was still fine. What I want to do in this video is change what you are watching for, because the brain does not fail all at once. It changes slowly in regions that do not always involve memory first, and the signs that appear in those early stages can look like personality, like mood, like stress, or depression, or grief, or simply the natural quieting that comes with age. They can look like almost anything except what they actually are. Stay with me through this entire video. The information I'm about to share is the kind that most families only receive after something has already gone wrong. I want you to have it now, while there is still time to act thoughtfully. Let me begin with the misconception that causes the most harm. Most people hold a very specific image of dementia in their minds. It is the image of someone who cannot remember where they are, who cannot recognize their own children, who is lost inside their own home. That image is real. It is something that can happen in the later stages of certain conditions, but it is not the beginning. It is not where the brain changes start, and building your awareness around that late-stage image means you will miss the early window, the window when medical evaluation is most useful, when reversible causes can be found and treated, and when families can plan and prepare in ways that protect everyone involved. Here's what the research actually shows. The brain changes associated with Alzheimer's disease can begin accumulating silently for 10 to 20 years before the person shows obvious symptoms. Other conditions that affect thinking, judgment, and behavior can also begin with very subtle changes that have nothing to do with forgetting names or dates. The second misconception is equally dangerous. Many people believe that if the person is still sharp in conversation, still functioning day to day, still reading and engaging, then nothing serious can be happening. This is not a reliable test. The brain is remarkably good at compensating in the early stages. It routes around damaged areas using other pathways. A person can present as highly competent in a focused one-on-one conversation and still be struggling significantly with the kinds of tasks and decisions that require intact frontal lobe function. The third misconception is that memory problems and dementia are the same thing. They are not. Memory is one system among many. There are people whose memory remains relatively intact for years, while other abilities, including judgment, impulse control, language planning, and emotional regulation, are already compromised. Some forms of dementia affect personality and behavior first, and memory later. If you are only watching for memory loss, you will not see these. The first early sign I want you to understand is personality change. Someone who was warm becomes irritable. Someone who was patient becomes easily frustrated by small things. Someone who was socially engaged and genuinely enjoyed people begins withdrawing from gatherings, from phone calls, from conversations they once initiated without hesitation. They stop pursuing hobbies they used to love. They may become unusually suspicious of people they have trusted for years. They may seem emotionally flat, less responsive, less present, as though the warmth that defined them has been turned down. Families explain this away in understandable ways. They say the person is tired. They say that getting older changes people. They may be right, but they may also be watching the first signs of a brain that is changing in the regions that regulate social behavior, emotional response, and interpersonal connection. Certain forms of dementia, particularly frontotemporal dementia, which affects the front and sides of the brain, can begin almost entirely with personality and behavior changes. Memory can remain largely preserved for years while the person becomes a noticeably different version of themselves. More impulsive, more withdrawn, more suspicious, or less socially aware than they once were. Families often spend years trying to understand why their loved one has changed before a diagnosis is ever considered. The key question is not whether the person is different from other people their age. The key question is whether they are different from who they were. You are looking for change from their own baseline, not comparison to a general standard. The second early sign involves judgment and decision-making. The circuits in the brain responsible for evaluating risk, filtering impulses, and applying careful, deliberate thinking are located primarily in the prefrontal cortex. These are among the circuits that can be affected early. What this looks like in daily life is subtle at first. The person may respond to a phone call from an unfamiliar number and give out personal information they would never previously have shared. They may donate money repeatedly to causes they just heard about without the skepticism they once showed immediately. They may purchase things they do not need, agree to arrangements that seem clearly unfavorable, or fail to notice that something is wrong in a situation that would previously have set off an immediate alarm. The important detail here is the phrase, out of character. If someone was always impulsive with money, that tells you little. If someone who was always careful with money begins making unusual financial decisions, that is a pattern worth investigating carefully. The third early sign is difficulty with planning and the execution of familiar tasks. This is not forgetting where you put your keys. This is standing in the kitchen in front of ingredients you have worked with for 40 years and not being able to organize the steps of a recipe you have made hundreds of times. This is a normally organized person finding that managing a bank account, which was once automatic, now requires repeated effort and still produces mistakes. The brain function involved is called executive function. It includes the ability to plan, to hold multiple pieces of information in mind at the same time, to shift between steps, and to monitor progress. When this system begins to fail, the person is not simply forgetting. They are losing the ability to organize and sequence, which is a different and often more disabling problem. What makes this sign so easy to miss is that the person may explain it away convincingly. They may blame fatigue or distraction, and sometimes they are right. But when this pattern is new, and when it involves tasks the person once performed automatically, it deserves medical attention. The fourth area involves mood, and this is where the most confusion and misdiagnoses occur. Depression, anxiety, and early dementia can look almost identical. A person who becomes withdrawn, loses interest in activities they once enjoyed, sleeps poorly, and seems to have lost their energy, and motivation may be experiencing depression. They may also be experiencing the earliest stages of a neurodegenerative process. They may, in fact, be experiencing both at the same time. This matters because depression is treatable. If a physician assumes that a person's behavioral and emotional changes are explained entirely by depression and treats accordingly, without also evaluating cognitive function carefully, a significant window for early intervention may close. At the same time, if every mood change in an older adult is assumed to be cognitive decline without proper evaluation, people who could benefit from depression treatment are left suffering unnecessarily. The key warning sign is a new pattern, especially when it is accompanied by practical mistakes. When emotional flatness or withdrawal is paired with difficulties managing daily tasks, unusual decisions, or moments of clear confusion. That combination is worth bringing to a physician promptly. I also want to address anxiety specifically. Late-life anxiety that appears for the first time or that escalates significantly after years of being mild can sometimes reflect early cognitive change. The person may be anxious because they are noticing on some level that things are not working the way they used to. They may not be able to articulate what is wrong. The anxiety may present as excessive worry, repeated checking behaviors, or a new need for reassurance that was not previously characteristic of them. The fifth early sign involves language. You may notice that the person pauses more often in the middle of sentences. They reach for a word that should come easily, hold for a moment, and then either substitute a vague term or change direction entirely. They may call a familiar object that thing or describe it by what it does rather than by its name. They may become quieter in group settings, not because they have lost interest, but because following a fast-moving conversation has become harder than it used to be. Over time, this difficulty can lead the person to withdraw further from social situations, which can then be misread as depression or normal aging. What is actually happening is that the effort required to participate in conversation has increased to the point where it no longer feels manageable. Language is one of the most cognitively demanding things a human being does. It requires holding thoughts in sequence, retrieving precise words, monitoring what has already been said, and adjusting in real time to another person's responses. When the underlying cognitive machinery begins to weaken, language is often among the first complex functions to show the strain. The sixth area involves changes in smell, sleep, and movement, and this one surprises most families entirely. In certain brain conditions, particularly those involving a substance called Lewy bodies, the earliest signs can appear years before any cognitive symptoms. A reduced ability to detect smell can be an early indicator. Acting out dreams, meaning literally moving, speaking, or striking out during vivid dreams, is a well-documented early sign of Lewy body pathology. This sleep behavior disorder can precede obvious cognitive symptoms by a decade or more. Changes in walking, a gait that becomes slower, shorter, and more shuffling, combined with subtle balance problems, can also be early indicators. Falls that seem to happen without a clear cause deserve careful neurological evaluation, not just a check for trip hazards. I am not telling you this to alarm you. I am telling you this because these early physical signs belong in a physician's notes. They help narrow the cause, which changes the approach to care. The seventh early sign is getting lost in familiar places or losing the sense of time in ways that are clearly new. This is different from occasionally needing to think about what day of the week it is. What deserves attention is when a person becomes genuinely confused in a neighborhood they have driven through for 20 years. When they lose track of what season it is or become confused about the sequence of recent events in ways that are new and persistent. The brain regions involved in spatial navigation and temporal orientation are distinct from those most often associated with simple memory retrieval. One can fail while the other remains relatively intact. The eighth sign is a pattern of repetition that the person does not register. We all occasionally tell a story we have already told. This is not what I am describing. What deserves attention is when the person tells the same story within the same conversation, with the same details and the same emphasis, with no recognition that they told it moments before. When they ask the same question multiple times in an hour, when they check the locks or the stove in a loop that does not seem to resolve, when they call the same family member several times in a single day without remembering the earlier calls. The clinical feature that matters is the absence of awareness, A person who catches their own repetition and comments on it is demonstrating intact self-monitoring. A person who repeats the same story 4 times in 40 minutes with complete conviction each time is showing something different. The 9th area involves hygiene, clothing, and the home environment. A person who was always meticulous about their appearance begins wearing the same clothes for several days in a row without noticing. A person who kept a clean and organized home allows dishes to accumulate and basic maintenance to lapse. Personal hygiene that was previously automatic begins to fall away. The reason this happens is not stubbornness or laziness. The automatic internal signal that once prompted these behaviors, the felt sense that something needed to be done, and the organized impulse to do it depends on frontal lobe function. When that system is compromised, the prompting simply stops firing reliably. The person is not choosing to neglect themselves. The signal is no longer there. The 10th sign, and in many ways the most important, is what I call the family signal. It is the moment when someone who has known a person deeply and for a long time says quietly, "This is not like them." Not they are having a hard time, but a genuine felt recognition that the person in front of you is behaving in ways that are inconsistent with who they have always been. The changes may be small, individually. They may be easy to explain away one at a time, but as a pattern across multiple areas of daily life, they point towards something that deserves medical attention. I have learned over 30 years of practice that this observation from a family member is one of the most valuable pieces of clinical information a doctor can receive. When someone who knows a person well says that they have changed in a way that feels fundamental, that assessment carries significant weight. If that is what you are feeling right now, I would encourage you not to dismiss it. I want to pause here and ask you something directly. As you have been listening, have you been thinking of someone? Have you been recognizing patterns I have described in a person you care about? If so, I would like you to write yes in the comments below. You do not need to share any details, but knowing that this information is reaching the people who need it most is important to me. Now I want to address something that Matt enormously for keeping this conversation medically honest, because the signs I have described do not always mean dementia. There are many conditions that can produce very similar symptoms and that are potentially reversible when found and treated. Medication side effects are among the most common and most overlooked causes of cognitive and behavioral change in older adults. Many medications prescribed for sleep, anxiety, bladder control, pain, and allergies can cause confusion, memory difficulties, emotional changes, and impaired thinking. These effects can be subtle and gradual, and they are frequently attributed to aging rather than to a drug the person has been taking for years. A careful medication review by a knowledgeable physician is one of the first steps in any evaluation. Vitamin B12 deficiency is a highly treatable cause of cognitive and neurological symptoms. As people age, the stomach produces less of the acid needed to absorb B12 from food. Over time, deficiency can cause memory problems, mood changes, and neurological symptoms that are easily mistaken for early dementia. A simple blood test identifies it, and treatment is straightforward. Low thyroid function causes fatigue, memory difficulties, depression, and slowed thinking that can be confused with cognitive decline. It is common, it is treatable, and it is found with a routine blood test. Poorly controlled blood sugar can significantly affect cognitive function and behavior in both directions. Undiagnosed or poorly managed diabetes sometimes presents with confusion and irritability that resolves substantially with better glucose control. Sleep disorders, particularly obstructive sleep apnea, cause fragmented sleep that prevents the brain from completing its nightly repair processes. A person whose brain is chronically deprived of restorative sleep will show difficulties with memory, attention, and mood regulation that can look very much like early cognitive decline. Treating the sleep disorder often produces striking improvement. Depression itself can produce what clinicians call pseudo-dementia, a syndrome of cognitive impairment driven by mood disorder rather than by neurodegeneration. When depression is treated effectively, the cognitive symptoms often resolve substantially. Urinary tract infections in older adults can cause sudden confusion and behavioral changes that have nothing to do with the brain itself. Dehydration can do the same. Uncorrected hearing loss and vision problems force the brain to work harder to process incoming information, accelerating cognitive fatigue. Alcohol use, even moderate regular alcohol use, can impair thinking and memory in ways that are consistently underestimated. I tell you all of this not to give you reasons to explain away what you are observing, but to explain why early evaluation matters so much. Finding a treatable cause is possible. Allowing a treatable cause to continue unchecked while attributing everything to aging is a harm that a proper evaluation can prevent. I remember a patient I will call Eleanor. She was 71 years old when her daughter brought her to see me. Eleanor had been a secondary school teacher for 38 years, precise, organized, and articulate. Her daughter came to the appointment alone first and described what she had been observing over the previous year. Eleanor had become irritable in ways that seemed entirely new. She had always been measured and patient with her grandchildren. Now she became agitated with them over small things, and then seemed almost confused about her own reaction. She had made 2 financial decisions that were genuinely out of character. She was sleeping poorly and had mentioned that food did not taste the way it used to. She was still sharp in one-on-one conversation and still remembering family events clearly. Her daughter said something I found very precise. She said, "My mother is still in there, but there is also something else in there now, and I do not know what it is." When we evaluated Eleanor carefully, we found a combination of factors. Her thyroid function was low, her vitamin B12 was below the appropriate range. She had significant undiagnosed sleep apnea, and there were also early cognitive changes that went beyond what those conditions alone could fully explain. We treated everything we could treat: her thyroid medication, her vitamin supplementation, and her sleep apnea. Her irritability improved considerably. Her energy returned substantially, but the early cognitive changes were real and remained. And knowing about them early allowed Eleanor and her family to plan thoughtfully, to have the conversations they needed to have, and to put support structures in place before any crisis arrived. Eleanor told me at a follow-up appointment that the most important thing that had happened was that someone had taken her daughter's observations seriously, rather than offering reassurance that everything was fine. That is what early attention can do. Let me give you something practical to carry forward from this video. If you are concerned about someone, do not argue with. About what you have noticed, do not point out their mistakes in the moment or say you already told me that. These responses cause distress and rarely accomplish anything useful. They create shame and defensiveness and can cause the person to become more secretive about difficulties they are experiencing. Instead, begin writing things down: specific observations, approximate dates, what happened, what was said, what seemed different from how the person normally would have responded. Over several weeks, a clear picture will often emerge. That written record brought quietly to a physician appointment is one of the most useful things you can offer a doctor who is trying to understand what is happening. When you speak to the person you are concerned about, choose words that protect their dignity. "I have noticed some changes, and I want to make sure you are well," is very different from "I think something is wrong with your mind." One opens a door, the other closes it. Ask the physician to review all medications carefully for cognitive side effects. Ask about blood tests for thyroid function, vitamin B12 levels, blood sugar, and kidney function. Ask about hearing and vision. Ask whether sleep quality has been assessed. These are not dramatic or expensive steps. They are the basic responsible starting points before any larger conclusion is reached. The brain responds to care and attention at any stage. I have seen patients whose confusion resolved entirely once a medication was adjusted and a nutritional deficiency was corrected. I have seen families who caught real cognitive change early enough to make decisions together, while the person who mattered most could still participate in those conversations and express their own wishes clearly. There is no version of this story in which waiting is better than knowing. The earlier you act, the more options remain available. The more time a family has to prepare to ensure safety and to preserve independence and dignity for as long as possible. You are not powerless in this. The simple act of paying careful attention and taking what you observe seriously enough to bring it to a physician is already far more than most people do. You watch this video, you're already paying the kind of attention that makes a difference. If this video has been useful to you, I would be grateful if you would subscribe to this channel. I share information like this regularly because what you understand between physician appointments is as important as anything that happens during them. Write in the comments below which of the signs I described today was the one you had not considered before. I read every response, and your answers help me understand which topics need more depth in future videos. Take care of yourself and take care of the people around you. Done with attention and intention. That is more than enough.